Hello, everyone. I'm Dr. Marty Ross, and tonight is another Conversations with Marty Ross MD. We're going to talk about Lyme disease tonight. I'm interested, as usual, to see what questions you have in store for me. Always interested to see if independently of each other, if you actually get into a theme of the night, and we'll see if that happens. For those of you that are new here, welcome. And to those of you that are coming back again, welcome as well, too. I'm glad to see those of you that are returning keep getting a lot of value out of this as well. For those of you that are new, there's two ways to participate. One is to see the questions as I post them in the live version. I'll also read them, too, and see how I respond. The other way is to write a question. And the way you do that is in the chat box on the right-hand side of the screen. You can write your question to me. I ask that you try to keep them to be shorter questions. I don't need your whole life history because it actually gets to be a little bit too long to be able to handle here. And in addition, as you're writing your question, only hit your enter key to send it to me when the whole question is complete. If you click that enter key to create paragraphs, it actually sends a number of questions to me, which gets to be hard for me to follow from this side. So I appreciate everyone for showing up tonight. Normally we do these on Thursday nights, but I'm actually have another obligation tomorrow that's keeping me from being able to be here with you tomorrow night. So I'm glad we're able to reschedule it for today. This is our last webinar of the month as we're near the end of the month. And we will have 3 webinars scheduled for next month. In tomorrow morning's email, where I send you a link for the recording. Yes, I am making a recording again tonight. When I send you that link announcing the recording is edited and ready to go with the synopsis of it, I also will include links to sign up for the next set of webinars that begin in August. And we will begin those next Thursday, actually, a week from tomorrow. So feel free to sign up. And if you do find benefit from this, know that other people will too. And so if you happen to know anyone else that has Lyme or has family members that have Lyme that would benefit, forward on the emails that I send to you announcing these webinars or that include the webinar recordings. I'd appreciate it if you'd help me reach as many people as possible. It's my mission to help as many people as possible. All right. So without any further ado, let's go ahead and get started here. All right, so let's see. It looks like we got a question from Mosby. Let's see. Mosby says, what are some of the symptoms of alpha-gal and are there any treatments? So alpha-gal, I have not had anyone in my practice that has experienced alpha-gal. And I know last week I got asked a question about this too. Because I have not had somebody experience alpha-gal, I'm not that biggest expert on it. I haven't taken the time to fully get it down. My understanding, though, is it is a condition that can be transferred by a tick bite, I believe the Lone Star tick, and people develop actually a meat reactivity. And that's all I know about it. So I'm not able to give you the best response on this, Mosby. All right. Sorry about that. Take care. Sorry, guys. I got something in my eye or an eyelash, I think, below my eye that's driving me a little bonkers here. Hopefully I got it there. All right, next question here. Hello, Mark. Let's see. Hi, Dr. Ross. I think all of us who attend your webinars can say that we really appreciate that you always give us your honest opinion on many different topics. I do have an opinion sometimes. I know you know that, but I appreciate you saying that. Thank you. I have heard that some people treat their Lyme disease using a substance known as chlorine dioxide or MMS that was made popular by a guy named Jim Humble. My personal opinion is that this is probably not a good idea to do as the MMS can be a strong oxidizer in your body. I would be worried about the side effects. However, I'm very interested to know if you have ever heard about MMS and what your thoughts are on it. Is there any way this could be a beneficial thing to use to treat Lyme? The co-infections, do you know of any harmful side effects? Thank you. So, I am aware of the treatment, and I occasionally will I don't recommend the treatment. In my practice, I haven't recommended it to anyone, but I'm aware of it. And I've had a number of people in my practice that have tried it on their own. My sense of it, in terms of it being successful, is it's a rare person that gets benefit from it. And there are some people that get benefit from it, or while they take it, they get benefit. Now, the reason I said it that way is that anything we give you, whether it's a prescription, an herb, or MMS, has the potential of providing benefit through what's known as a placebo effect, okay? Meaning it's not that you get better because of the substance, it's that you get better because you think you're taking something that's supposed to work, all right? So as an example of that, people have studied the various drugs that are in the physician's drug test reference or prescribing materials, and what we find is probably the potential benefit of anything we actually prescribe has a placebo effect of 30 to 40%, all right? So that's drugs that have double-blind studies where in these double-blind studies showing benefit or not having benefit, there are people that take a placebo and people that don't take a placebo. And even in the placebo group, people 30 to 40% get better. Okay, all right. And that's what I wonder is happening here with people that get benefit from MMS. As I look at it, I'm not aware of how it would do any effective germ killing or therefore have any potential benefit. I do acknowledge, though, that some people feel better when they're on it. It's a rare person, though, than what I've seen in my practice, okay? All right. If it is an oxidizer, I too share your concerns that anything that's an oxidizer long-term could have harmful effects, and so usually I don't advise those things either, okay? All right. Thanks for that comment, Mark, and thanks for your question. Hello, Tim. Hi, Dr. Ross. How are you doing? I'm doing well. Thank you. Let's see. On the macrolides, there are long QT warnings, which are also on some of my non-Lyme medications. What has your experience been with pairing medications with long QT warnings? Thank you so much. So your macrolides have that as a potential warning, Plaquenil as a prescription medicine. Actually, not Plaquenil, but macrolides have it. The quinolones, which would be your Levaquins, ciprofloxacin, which I rarely use anymore because of people getting quote unquote floxed by those. They have a QT prolongation too. Where I start wondering about, so the average person is not going to have any issues handling a medicine with QT prolongation. Where you start running into greater concerns about it is if you get to be an older person, and define older, right? So I'm 60, I would call myself an older person. But probably when you start getting more into your 50s and above, you're going to have tendency to have more problems with QT prolongation. I don't do any standard EKGs on these QT prolongation medicines unless somebody's probably about 50 and I'm going to use 2 or more at a time with a person. Then I might get an EKG with them on the medications to make sure that they're tolerating them okay. All right. So everyone, QT is a part of the electrical pattern of the heart. And if that segment of the electrical pattern gets prolonged, it can set up bad arrhythmia problems or heart rhythm problems. And so we want to try to avoid doing that, obviously. But I will tell you, most people can tolerate doing 2 and 3 of these QT prolongation medicines without any problem. The people that tend to be at greater risk, in my experience, would be people about 50 and above. Okay. And if you're using a lot of them together, and I would say more than 2 to 3. Okay. All right. Thanks, Tim. Hello, Carter. Let's see. I have a lot of burning skin around my chin and jaw. Is that a symptom you've seen before? So nerve injury has a number of symptoms that it can have. So one is numbness, okay? But another is burning pain. And other symptoms of nerve injury can include other types of pain like sharp, stabbing, burning, piercing, or electrical type pains, okay? So burning skin often is a sign of nerve injury. The only time that I would say it's not a sign of nerve injury is if there's actually a rash of some kind or skin changes that you can visibly see that go with it. In that case, it might be another condition. Okay. Good luck to you, Carter. Hello, JT. Hi, Doc. I see on your website you're not taking in new clients. Will this be changing anytime soon? 2, do you ever see Lyme Bart patients with motor nerve damage radiculopathy not caused by discompressing the nerve. 3, I started atobacascol for Lyme, and within hours of just taking 2 drops of each, I get horrible headache, heart palpitations, and major sinus congestion. Is it possible to Herx on such a low dose? All right. So regarding the not taking new clients, that I have permanently decided to stop taking new patients and to focus on the patients I have in my practice, as well as continuing to work on providing new content for my Lyme disease information site and administering my supplement store and making those products available. So I do not foresee that changing, unfortunately for you, but that's a life change I'm making. I've decided to focus more on my educational and support efforts that way as well. Okay. Number 2, do you ever see Lyme Bart patients with motor nerve damage? So it's possible. So Lyme can infect, and Bartonella can infect and affect how any nerve within the body works, including the large nerves that come out of the spinal cord in the back. So when a large nerve root that comes out of the spinal cord in the back gets affected, either crushed or infected or inflamed, we call that radiculopathy. And usually the pain and problems associated with that will follow a pattern that follows the nerve pathway, basically. Okay, so can Lyme and or Bart do that? Yeah, absolutely, they can do that. Let's see, I started Otoba. Okay, now, in terms of getting a reaction within hours, yeah, it's possible that Herxheimer reactions can occur pretty quickly. And in people that have a lot of sensitivity, 1 drop might set that off, okay? But the symptoms that you're describing here are not necessarily what I would call Herxheimer reaction symptoms, all right? So let's talk about what a Herxheimer reaction symptom usually is. So when you feel bad, and to do that, I need to talk about something called cytokines and what gives you most of your Lyme symptoms, and then we'll talk about Herxing. So basically, when you feel bad in Lyme disease, it's because your white blood cells are overproducing a group of chemicals called cytokines, okay? And cytokines made by your white blood cells are good and bad. On the good side, when white blood cells see an infection or see toxins in you, they will try to get rid of them. And some white blood cells, when seeing those problems, will manufacture cytokines. On the good side, cytokines are supposed to cause more white blood cells to be made, draw them to where the problem is, and help them work better at getting rid of the problem. Okay, those are the good things that cytokines are supposed to do. Now, if the immune system is trying to deal with the problem but has a hard time doing so, it may try harder and harder and eventually make too many cytokines. And too many cytokines give you brain fog, make you hurt all over, give you fatigue, cause hormonal dysfunction, cause sleep disturbances, give mental health problems, you name it. Mostly what we call Lyme disease symptoms are cytokine symptoms, all right? So when you Herx, what happens is your immune system sees all these dead bug parts and the toxins that get released from the dead germ parts, and it makes more cytokines. And what will then flare up is your underlying cytokine symptoms. So if your Lyme disease has as part of it horrible headache, heart palpitations, and sinus congestion, and those underlying symptoms that are already there from having too many cytokines flare up, then it would be fair to say those are Herxheimer symptoms, okay? Because again, a Herxheimer is a cytokine surge from killing germs. However, if these are symptoms that are ordinarily not part of your Lyme disease and suddenly they're there when you're taking these even in small amounts, then I would think about some type of an abnormal, atypical reaction to the medicines. And the way to figure out which one of them it might be is to stop both and try one at a time and see if it's giving those types of symptoms, okay? All right. Good luck to you, JT. Thanks for that question. Hello, David. Hold on here just a minute. Hi, Dr. Ross. Have you used low-dose naltrexone and or Singulair to treat for mold toxicity or Lyme, Bart, or Babesia? If you have used them, what was the reason for using them? My new mold doctor believes these meds will help with mold toxicity and lower inflammation that showed extremely elevated on both my C4A and TGF-beta1. I read that Singulair can have pretty nasty side effects. Thank you. Thoughts as always. Thank you. All right. So let's start with C4A and TGF-beta1 first, and then I'll kind of expand out to answer your question from there. So everyone, complement 4A, also known as C4A, is a chemical that gets made by your immune system when it's fighting germs or fighting mold toxins. And in the world of Lyme disease and mold toxicity, it can either become elevated because you're loaded with Lyme, or it can become elevated because you're loaded with mold toxins, or it can become elevated for both reasons, okay? TGF-beta1 is a good cytokine. Not all cytokines are bad, okay? So TGF-beta1 is a cytokine that's made to decrease inflammation from other cytokines. Kind of think of it as the anti-cytokine cytokine, okay? And when it's elevated, it means that you have, it's trying to counter a lot of inflammatory other cytokines in a sense, all right? And it can become elevated from active Lyme, or it can become elevated from active mold toxicity. So I had a question last week, and David, it may have been from you, asking what's the significance of the values that were elevated. And as I said last week, and I'll say again, whenever you get an elevated C4A and a TGF-beta1, it does not mean you have mold toxicity. It could mean you have Lyme disease. And so you need to figure out which one you got before claiming to have mold toxicity. So there's a whole group of mold toxicity doctors out there that never measure whether you have mold toxins in you. They only measure the inflammatory chemicals that get made by mold toxins. They ignore the possibility that Lyme could be causing those and automatically claim that everyone that has C4A and TGF-beta1 is mold toxic, right? But that's not necessarily so, because Lyme can do the same thing. So what I do, and most of us that treat Lyme do, we don't rely on those to tell us somebody has mold toxicity. We actually rely on urine mycotoxin testing to see, do you actually spill out and pee out a lot of excessive mold toxins, all right? So David, if it was you that asked a similar question last week, make sure you've done that, all right? Now, clearly you have some inflammation here. And so low-dose naltrexone is an option that could help. And I have used a lot of it in my practice for people with Lyme and occasionally for a person with mold toxin illness. It, however, will take a while to get the inflammation under control. And in fact, when you use it, you have to wait a maximum of 6 months to see if it's really going to make a difference at all. What naltrexone is it's originally is a medication that is designed to treat people with narcotic overdose. It's manufactured as a 50 milligram pill. It's also used to treat alcoholics because it can decrease alcohol craving as well too. When we use it low dose, we actually dose it anywhere from about 1 to 4.5 milligrams. That's what makes it low dose, and it has to be compounded by a pharmacist. What it does is when you take it, it winds up blockading a group of receptor sites in your body called endorphin receptors. Our bodies manufacture endorphins to help regulate pain, but they also regulate the immune system, okay? And therefore they regulate inflammation. And so if you block your narcotic receptors, your endorphin receptors for a brief period of time, like 4 to 6 hours with low dose naltrexone, what winds up happening is those receptors that are blocked get super sensitive to any naltrexone that's or endorphins that are out there. And in addition, the brain sends out a bunch of signals to the body saying, make more endorphins. We got to overcome the blockade. Okay. So at 4 to 6 hours after you take your naltrexone pill, these receptors that are now super sensitized to endorphins get flooded with extra endorphins. And that has an action that can decrease inflammation. It can sometimes decrease inflammation. Okay. Sometimes. All right. But if you're going to do it, it takes about 6 months to work. Singulair, I have not seen used for what your doctor is using it for. Singulair is used to deal with the inflammation that is usually part of asthma and allergies. I am not sure why your mold doctor would be doing it here, because when somebody has mold toxin problems, they're not having mold allergies. They're responding to the toxins that are in them. Now, on the other hand, if for some reason your mold doctor thinks you're also having allergic reactions to the mold in your environment, then that might be a reason to use it. But as something that deals with the toxin inflammation or Lyme inflammation, I don't understand how that would work. All right. Thanks for your question. Good luck to you, David. Hello, Duke. Let's see. Hi, Dr. Ross. If you were to test someone using IGeneX for Lyme, Bart and Babesia, what tests would you typically order? Also, the patient was not worried about the cost of additional tests. Are there any other tests that you would also order that might be helpful? Your webinars and websites are the best resources there on Lyme. Thank you. I appreciate that. That's my goal. I want to make it accessible and people have the information they need to either figure this out on their own or with their physicians if they have a physician that's going to help them. So good. I'm glad to hear that. Thanks for taking the time to do that. You're welcome. Thanks, Duke. All right. So in terms of IGeneX, in terms of labs that do testing for tick-borne illnesses, I know there's various options and techniques that labs can do. I still think IGeneX is the best lab out there. And this is from working with it over time and seeing how they keep developing new tests to match what's going on out there. Okay. So in terms of Lyme testing, my preferred test for the Lyme germ, not Bartonella Babesia, but for Borrelia Lyme, is the test called the Lyme immunoblot. And I would get both an IgM and an IgG. All right. That test looks to see if you have antibodies against 8 different kinds of Lyme, including some European strains that are now becoming some of the major strains on the east coast of the country. And that would be Borrelia afzelii and Borrelia guerini. Okay. In addition, their test picks up Borrelia burgdorferi, which is the predominant strain here in most of the country. All right. Plus 5 other strains. All right. So that's what makes it a good test. It has a bigger fingerprint. All right. The other thing that makes it a good test is that they grow the proteins from these 8 strains of Lymes in the lab, and they genetically modify them. And which is good about that is they modify them to remove parts that would attract antibodies for viruses. And if these Lyme proteins hold on to virus antibodies during our testing, they'll give us a false positive test. Okay, so the immunoblot tests for more strains than any other lab out there, and in addition, gets rid of the false positivity issue. Okay, now I want to compare and contrast that with InfectoLab and Armin Labs. Both of those labs are not doing antibody testing, but rather they're doing something called a T cell activation test or an ELISpot. And what they're doing, T cells are the type of cells that fight infections. And they're measuring, do your T cells react to proteins from the various germs? So in the case of Lyme, they take your T cells, they expose them to Lyme proteins, and they see if your T cells release cytokines. Okay, all right. Now the problem, which in theory might be good, what we do know though is that generally ELISpot testing for any condition is wrong 15% of the time. Okay. By comparison, the immunoblot will find, according to IGeneX sensitivity testing, will find Lyme if it's there 95% of the time. But the bigger problem with Armin and InfectoLab is they're only looking to see, InfectoLab is only looking to see if you have reaction to Borrelia burgdorferi, not the other strains. Okay. Armin will look to see if you have afzelii and guerini, I believe, and burgdorferi, but they're missing the other 5 strains. All right. Okay. All right. Bartonella testing. In terms of Lyme at IGeneX, I would not do anything else but the immunoblot. The PCR test they do will only find Lyme if you have it 30% of the time. Okay. And there's no reason to do a Western blot. The immunoblot has replaced that, basically. All right. The ELISA testing is a screening test that misses Lyme 50% of the time. Don't waste your money on that. Okay. All right. Bartonella. In terms of Bartonella testing out there, I do also believe IGeneX is offering one of the better tests out there. All right. So Bartonella, what they're doing is they're measuring to see if you have antibodies against 4 specific strains of, and their test is called the Bartonella immunoblot, I should say. They're looking to see if you have antibodies against 4 specific strains of Bartonella, and in addition, the whole family of Bartonella. We recognize that there's 15 strains of Bartonella, 15 kinds of Bartonella that can infect a person, and effectively their lab is picking up all 15 strains. So, for instance, if you get the 4 specific strains they can measure, if those are negative, but your family test is positive, it means you got one of the other 11, okay? That test, in terms of sensitivity, its ability to find Bartonella, if it's there, seems to be around 90%. All right, that's pretty good. That's pretty good. All right, they also offer a Bartonella test called a FISH test, which is a microscope exam that uses a fluorescent agent that attaches to Bartonella in your blood. It has a very low yield, though. You have to be like pouring out Bartonella for it to be seen. Okay, so I don't find that one beneficial. There's also a Bartonella PCR test, and again, that has a low yield too, because Bartonella just doesn't live in your blood. Okay, all right. For Babesia, and then one other thing. So there's another lab out. So then, in terms of the ELISpot testing for Bartonella that Infecto Lab and Armin do, their test is inadequate. And the reason it's inadequate is they only test to see if you have T-cell reaction against Bartonella henselae. They missed the other 11 strain or the other 14 strains. Okay, so don't waste your money there. Okay, I wouldn't waste your money there. Okay, all right. Then in terms of Babesia, Babesia is not perfect no matter where you go, what other lab you use. All right. So IGeneX has the ability to do antibody testing against Babesia microti and Babesia decani. Okay. They don't test for a strain called Babesia oticoli. However, it's possible that their Babesia decani testing is actually picking up a lot of oticoli. Okay, possible. All right. That probably still is their best test. They also offer a Babesia FISH test. My experience is that you have to be just like having loads of Babesia in you before that will be positive. So I don't think it gives you the greatest yield. Okay. I believe they have a Babesia PCR. Again, that gives a low yield as well too. All right. Now, Infecto Lab offers, I think they're offering testing for microti. I don't know that they're offering decani. And Armin, I believe, is only doing microti. All right. So they're not picking up as many strains. Okay. What I will tell you is Bartonella and Babesia, the testing, as I said, the best you can do is probably IGeneX immunoblot for Bartonella. For Babesia, do the IFA microti and the IFA test for microti and decani through IGeneX, maybe the FISH test if you have some extra money. Those are your best bets. Okay. And then in terms of Bartonella, one other lab I should focus on. There's a lab out there called Galaxy Labs that is doing an enhanced PCR test to see if you have Bartonella. And when it comes back positive, it really means you got Bartonella, okay? The trouble is they can't tell us how good their test is at finding Bartonella when it's there because they can't quantify it. They haven't been able to do that testing. So as I've said, Bartonella doesn't fully live in the blood. It lives in cells. And so I have no idea at how much Bartonella they're missing. I do know when they find it, it's a very accurate test, okay? So what would I do if I was testing for Bartonella for these infections? For Lyme, I would do their IgM, IgG immunoblot. For Bartonella, I would do their IgM, IgG immunoblot. And for Babesia, I would do the IFA testing for microti, for decani, and probably do the Babesia FISH test. That's probably where I would go, okay? All right. I think I answered your questions there. All right. Very good. Good luck to you, Duke. Hello, Al. Hi, Doc Marty. What's the relationship between chronic fatigue and carditis? Have you ever used Hawthorne to treat carditis, after which the fatigue was resolved without the use of antibiotics? So, Al, I'm puzzled on how to answer this. So chronic fatigue syndrome is a fatiguing illness for which we are not able to identify a cause. Okay, let me just start by saying that. All right. Now, if you get carditis, inflammation of your heart, as part of that, you may have fatigue, but I wouldn't technically call that chronic fatigue syndrome, because in that case, it's the carditis that's leading to body-wide fatigue because your heart's not working well enough. You have an infection, you have inflammation, and you're fatigued. Okay. So I want to make a distinction. Carditis does not cause chronic fatigue syndrome, but it could give chronic fatigue that is not chronic fatigue syndrome as part of having the inflammation of the heart and the heart not working as well. Okay. Now let's see. Have you ever used Hawthorne to treat carditis, after which the fatigue was resolved without the use of antibiotics? No, I haven't. That's not to say it couldn't work. Hawthorne would be good for anything that's heart related. Generally, it should be good against anything heart related. But no, I'm not aware of that. Okay. Thanks, Al. Good luck to you. Hi, Mary. Let's see. Hi, Dr. Ross. I have a long history of Lyme, Bartonella, Babesia. I recently had a bad relapse. I have treated with IV doxy 400 milligrams with artemisinin for 4 months. After the doxy for the past 4 months, I have been treated with Zithromax and Mepron, gradually increasing Mepron dosage to full dose 1 month ago. I also added Ceftin 1 month ago. I'm still struggling with depression, anxiety, and leg weakness with little improvement. What am I doing wrong or missing? Thank you. Wow, Mary, I'm sorry to hear this. And unfortunately, with the history you've given, I'm not sure. I would need to ask you, this is complex as you can imagine, and I would need to ask a lot of questions. There's only one observation I would ask that you take a look at, okay? And being a little bit different than what should you take for what's happening, okay? The one thing I have found in my experience practicing and treating Lyme is that every time that somebody has symptoms that look like a Lyme relapse, it's not always a Lyme or a Babesia or a Bartonella relapse, okay? The other condition that looks just like a Lyme, Bartonella, or Babesia relapse is getting too many yeast in your intestines. It can look identical. I mean, I can tell you stories of people that I have gotten well from Lyme and came in a year, 2 years later with all of their symptoms all back again. And I ascertained during the visit that they probably had too many yeast in their intestines. We treated it, and within 1 to 2 months, everything went back to normal again. Okay. So the missing part here, not missing in terms of using the right drugs for your infections, but the missing thing that you ought to consider with your provider is, do you have too many intestinal yeast? Okay. So, and in fact, that when I have somebody that comes in for a relapse, I see that about 80% of the time, if I treat yeast, that is what turns people around. Okay. 80%. That's pretty high, actually. So why yeast? Why would yeast do that? So, if you've been on antibiotics before, herbal or prescriptions, you're going to be set up for years to get too many yeast in your intestines because of disturbances those create to your microbiome in your intestines. Even if you've used probiotics, you're going to still be a setup for it, okay? So you have a situation where you could get too many yeast. If you do get too many yeast living in your intestines, the white blood cells that line the intestines will react against them. And keep in mind, 70% of our immune system lines the intestinal tract. There's a lot of white blood cells and types of white blood cells that are sitting there ready to be all inflamed, okay? So if those white blood cells see too many yeast in your intestines, they'll manufacture cytokines. And as I said earlier tonight, what gives you your Lyme, Bartonella, Babesia symptoms? It's excess cytokines, all right? So yeast can trigger those excess cytokines. In addition, if you have too many yeast in your intestines, they release toxins, and those toxins sometimes have neurotoxic effects as well too. At least that's what I've seen in my practice. Okay, all right. Now, how do you know if you might have too many yeast? Well, you start suspecting it because you've relapsed. Okay, number one. Number two, look to see if you have any of these. Do you have increased sugar cravings or carb cravings? Do you get worse after having sugar or simple carbs? Like you have your 2 potato chips and you suddenly notice that you have a flare up in all your symptoms. Okay, those are simple carbs. Okay, all right. Do you have worsened skin problems like pimples or acne or eczema? And how that occurs is those toxins that yeast release get absorbed into your bloodstream, go out to your skin, interact with the skin, leading to these pimples or rash problems that people get, okay? If you're a woman, do you have increased vaginal itching or vaginal discharge? Do you have a lot of gassiness and bloating in addition to those sugar cravings? And sometimes the thing that can indicate yeast is if you suddenly start developing a lot of difficulty swallowing, it feels like stuff is catching right in here or all the way in the back of your throat. And the relationship there is if you get too many yeast in your food pipe, you can get symptoms like that as well too, okay? So those are some things for you to think about. You might want to talk to your doctor. You guys may be treating the wrong thing. Or maybe treat the right thing, and on top of it, you got too many yeast sitting there, okay? But look into that. That would be something I would take a look at. One last thing I've seen rarely occur is in between the time that I saw a patient that had Lyme and then they came back to see me again, they got exposed to tons of mold toxins. And mold toxicity also can trigger a syndrome that looks just like Lyme, Bartonella, Babesia. Because those mold toxins get trapped in you. They trigger excess cytokines as well too, all right? So for that, you would want to do a urine mycotoxin test, and the lab I like to use for that is a lab called Real-Time Labs, all right? So I'm going to show you some articles here, but I just realized I forgot to load them up. Hold on just a minute. I got to get my, I got to get set up to show you parts of my website. Let's see. All right, so let me do a quick screen share here. Okay, so this is my Lyme disease information site. Okay, and so in terms of, I'll show you one thing. So this is my Lyme disease treatment protocol. All right, and one of the sections that I've written, section 15 says, health decline after doing better. All right. And basically, this is where I say that think about intestinal yeast. Okay. So I build this issue into my protocol. Okay. Just to show you how important that is. Okay. So to figure out if you have yeast, you might want to look at this problem, this article called a silent problem. Is it yeast? Okay. And you also, if you do determine it's yeast, take a look at this article called Kills Yeast, a brief guide for things that you might want to do for that. Okay. All right. Then in terms of mold toxicity, take a look in my detoxification section here and take a look at my article here called Mold and Lyme Toxin Illness. Okay. And I walk you through how this looks just like those, what mold toxicity is, how it's different than mold allergies, and how you would test for it. Okay. All right. Good luck to you, Mary. Mary, the reason I'm also, I should say, that I suggest you look outside of thinking of the tick-borne illnesses is you're not getting better with treatment. So you got to start wondering, is there something else going on? Okay. All right. Good luck to you. Hello, Justin. Let's see. My legs feel very heavy and weak and burned. Do you know what causes this? So burning can be a sign of nerve injury, neuropathy. Weakness and heaviness can be too. It could be that you've got some, it could be, and again, I would need to ask you a lot more questions to figure out if there's other things it might be, but one possibility is neuropathy, and that would likely be caused by either Lyme and or Bartonella. Okay? All right. Good luck to you, Justin. Let's see here. Hello, Charlene. Let's see. Hi, Dr. Ross. Do you know of anything that could get into the bloodstream? Charlene, I'm not sure how to answer that. Are you talking infections? Are you talking mold? What? I'm not sure what you're talking about here. I'm not sure how to answer that. I apologize. All right. Hello, Joyce. Let's see. Hi, Dr. Ross. Over the course of 20 years with diagnosed Lyme, Bart and Babesia, I have lost a lot of muscle tone, primarily in my upper body, despite being active and lifting weights on a regular basis. I follow a healthy lifestyle and subscribe to your herbal protocols and suggestions. Both times I was bitten, it was on my upper body. First time behind my left armpit, second time behind my right armpit. Have there been any studies showing damage to the area of the body is in close proximity to the bite? Damage starts to appear within a few days of being bitten. 20 years out, I have strings for muscles, and my upper body looks like skin draped over bone. I am otherwise healthy at 5'6", 126 pounds. No doctor can figure out anything. Everything I know is from reading books or called from the internet. There has to be something more for us. As always, thank you for all you do from these great webinars for your information filled website. Look forward to reading your book. Thanks. Thanks, Joyce. I appreciate it. And yes, that book. Yeah, my book is really going to be a compilation of a lot of things I have on my website. And I've delayed because I've been working on some personal project, mainly fixing up a camper van, believe it or not. And so that's taken a lot of my time, but I will be getting back to it here probably within the next week or two as that project is winding down. But the book it's actually about 70% written. I've got to get back to final editing and recompiling a few more pieces from my website and getting that all put out. There really probably won't be much new material because as I develop new material for the book, I'm posting it on the website. But people like to have something they can carry around in their hands, okay? So, so just some comments. So first of all, I haven't seen anyone that has the degree of muscle wasting that you're describing here, okay? I have to acknowledge that, okay? I have had people have some muscle wasting that does occur, though. All right, so first of all, in terms of your question about do you get more damage near the site of infection, it is true that you may get more spread in the immediate area of the germs. However, once those germs start spreading, they get into your bloodstream and actually go everywhere. And in fact, I think, for instance, there have been studies done looking at shows, I think within 4 hours of getting a tick bite, you've already crossed into the brain with Lyme. So I know not everyone has bad neuro-Lyme, but if you have Lyme anywhere, it also means it's probably in your brain as well too. Okay, unfortunately. All right, so it can go everywhere. People that get bullseye in one spot, sometimes they start getting bullseyes in other spots of their bodies because it spreads through the blood to other areas of the skin, and you get people that react with bullseyes, not just at the location. All right. Could you get more damage near the bite? Maybe, but I would also say it can go everywhere. Okay. All right. All right. Things that can give muscle wasting, and I'm sure your doctors have considered this. Maybe not, but excessive cytokines can lead to muscle wasting. Okay. And that's usually going to be more of a problem while you have active infection. You have excessive cytokines, and that usually should improve once you get the infections under control. Another thing that can lead to muscle wasting is nerve injury can lead to muscle wasting. The nerves that supply your muscles have two functions. Number one, they send the neurologic signal to your muscles to work. Okay, contract here, contract there, relax here, relax there. Okay, those are nerve signals that do that. Okay, but the other thing that the nerves do is they release substances that are supposed to help maintain muscle mass. And if you get nerve injury to that part of the nerve, you may have loss of its ability to maintain muscle mass. So that may be something for you to consider with your doctors. Okay, that part of it. Okay. Now, if it is due to nerve injury causing that, the one thing that may, and I say may, I don't know for sure, may give some benefit would be peptides. So the neuropeptide, or the stomach peptide called BPC-157 has historically been used by athletes to repair tissue damage. And then we in the world of Lyme disease and anti-aging medicine have been using it more recently because we know it can repair lots of kinds of damage, all right? So muscle pain, joint pain, muscle tendon inflammation, nerve injury. I have seen it help with nerve injury. And so it also has the ability, BPC-157, also has the ability to change balance of your immune system so that it allows your germ-fighting parts of your immune system to work better and the inflammatory parts to quiet down. So the way you'd use it is you would take one pill twice a day. The company that makes that is called Integrated Peptides. I'll show you an article where you can look at that and learn more information about it too, okay? That's something to think about. I don't know if it will work or not, okay? The other thing that may lead to muscle wasting is if you have energetic impairment of the muscle energy factories, and that would be mitochondria dysfunction. Mitochondria dysfunction can also be triggered as a result of having had infection. And so mitochondria are the energy factors in each one of our cells. When we have infection, we have too much oxidizing agents in our body made by the immune system trying to attack the infection. And those oxidizing agents can injure the mitochondria membrane covering. And if your muscles don't have enough energy, they're not going to grow, basically. And so the way to repair that is to fix the mitochondria membrane using phospholipid fats. The product I like for that is a product called ATP 360 by Research Nutritionals. And you would take 3 pills one time a day. I would give it a couple months to see if it starts making any notable change, okay? The other thing to couple with that is to be on a good antioxidant that will help decrease the oxidation damage inside of your mitochondria, and that's to use liposomal glutathione. Liposomal means it's microscopically wrapped in fat to increase its absorption. The product I like for that is Trifortify by Research Nutritionals because it's got great absorption. They've done studies to prove that. And I would do a teaspoon a day of that. Okay. All right. So a few things for you to think about is BPC-157 to help repair injury. Second one is to repair your mitochondria with ATP 360 and also with the glutathione. Consider if you might have mitochondria that cause excessive cytokines leading to muscle mass loss, and consider if you have nerve damage causing your muscles to not get the signals to maintain muscle mass, okay? Those are some thoughts, all right? Anyhow, there you go. Good luck to you. I'll do a quick screen share and show you where you can get some more information here. Okay, so in terms of mitochondria repair, take a look at my article. You're going to find it in the energy and fatigue section. And take a look at this article called How to Fix Mitochondria and Get Energy in Lyme Disease. And the two recommendations for the ATP 360 and glutathione are what I would do here. All right, but you can read more about it there, okay? And then in terms of peptides, look at my repair and restore chapter and take a look at this article called Repair and Restore with Peptides in Lyme Disease or Mold Toxicity. And here I talk about BPC 157, okay? All right. All right. And then where do you get these peptides? Well, peptides can be injectable, but there's also oral ones too. And the company that's making the oral versions is called Integrated Peptides. And these are the ones I currently have. The BPC 157, Can't Wait, Cerebro Prep, which is cerebrolysin, that can help with thinking and brain injury. And then this one called TB4 Frag Max, which is something called TB4 Frag that can help balance your immune system too. There is also a new one that has been released by Integrated Peptides called KPV Oral Spray, which can help with mast cell activation issues. And I believe they also have, anyhow, there's a couple new ones that have been released by Integrated Peptides that I will be getting more information out here soon and also start carrying those products here as well too, okay? All right. Good luck to you, Joyce. Hello, David. Let's see. We can't get rid of mold using binders and become a self-producing mold factory. What's the next step in treatment? And will you ever get rid of mold toxicity, or will you have it for the rest of your life? All right. So what David's referring to is some people with mold toxicity not only gather it from their environment, they breathe in mold toxins from houses that have mold behind the walls, but they start actually producing their own mold toxins. And so how that happens is when you have mold toxicity, you probably have been in a building with mold, okay? Or you have been in a building with mold. And some people breathe in the mold spores from the environment in the mold. And those mold spores can colonize your nose passages and your intestinal passages. And there they start producing their own mold toxins, all right? The person that you start wondering, are they colonized? Because not everyone is. In fact, the majority of people probably are not. But there is a group of people that do get colonized. And when I start thinking somebody might be colonized is usually after about 4 months of using binders. I'm going to go back in and retest them with the urine mycotoxin test. And if they still have significant elevations, then I start wondering two things. Number one, is the home environment or will they work clean? Or are they still being exposed? Okay. And number two, are you producing your own toxins? Are you colonized? Unfortunately, we don't have a good test that says you're colonized here or colonized down in your intestines. Okay. So we have to kind of back into that, thinking that or diagnosing that based on how you respond to the binders. So if you are a person that might be colonized, then we need to kill them. Okay. And so we can use agents that kill mold in your intestines, and we can use nasal sprays that kill them up in your nose, and you need to do both. So one way that you can kill them in your intestines is to use prescription itraconazole, 100 milligrams, 2 pills 1 time a day. Some of that will get into your bloodstream and work its way back into your nose, okay? Another way to kill in the intestines is to use something called amphotericin. That has to be compounded, 200 milligrams 3 times a day. I don't know that I have found a good herbal way to do that, okay? In the nose, you can do nystatin nose sprays. You can do silver nose sprays. You can do itraconazole nose sprays, and you can do amphotericin nose sprays, all right? And usually you're going to do that for about 2 to 3 months, and usually you can get rid of the being a brew pub problem, if you will. Okay? All right. Good luck to you, David. Hello, Shayna. Let's see. How do you treat SIBO both with prescriptions and without? All right. So I have an article about this. I will show it to you here in a minute. But so SIBO, everyone, stands for small intestine bacteria overgrowth. What that means is you got too many bacteria living in your small intestines. You're not supposed to have many living there, okay? But if you get too many, what happens is they ferment different sugars in food, giving you a lot of gassiness and bloating. In addition, that infection being there triggers cytokine excess. It's another cause of cytokines, okay? The way you diagnose it is to do a breath test where you drink some sugar water first, and then after, over the course of 2 hours, if you're not constipated, or 3 hours if you are constipated, you breathe into these little collection containers and you send it off to the lab. And the lab is going to measure whether you're making too much hydrogen or too much methane. If you do make too much hydrogen or too much methane, we call that SIBO, okay? That way of finding SIBO will identify it about 70% of the time it's there. The gold standard way of determining if you have SIBO is actually to do endoscopy, tube down your mouth into your throat, through the stomach, into the small intestines, and once in the small intestines, draw some of the fluid and see, are you really growing the stuff, okay? All right, okay. Now, if you have hydrogen-producing SIBO, that is a lot easier to get rid of than methane-producing SIBO. Hydrogen-producing SIBO often is going to respond either to 2 weeks of a prescription medicine called rifaximin at 550 milligrams twice a day, or you could do a candibactin AR, and you would do a couple pills twice a day, and that may take about a month. Okay, so candibactin AR for maybe a month with hydrogen-producing, and then the rifaximin for about 2 weeks. Okay, all right. Then methane producing SIBO is a lot harder to treat. And you're going to need to do two things. So you could do it with a candibactin AR, which has a number of herbs in it that treat SIBO. And you would do 2 pills twice a day, but you're going to take at least 2 months. The other option would be to do rifaximin that I mentioned earlier, also known as ifaximin. And that would be 550 milligrams twice a day for a month. And you would combine that either with the candibactin AR, which is a supplement, or you would combine it with neomycin, 500 milligrams twice a day. And normally it takes about 2 months, okay? Now, to decrease a lot of the gassiness and bloating for a month or two, you might also want to be on a low FODMAP diet. That's FODMAP. You can Google those and find those, okay? But there's certain foods that you remove from your diet. Let's see, FODMAP is fructose, oligosaccharides, oligo and disaccharides, monosaccharides. I'm blanking. Anyhow, it's a bunch of foods that you want to remove that provide too much sugar that the bacteria ferment and give you gas, okay? It's mainly for comfort reasons that you're going to do that. It's not necessarily going to help you over time. The other thing you want to do is change your diet so that it emphasizes plants, because healthy plants promote good bacteria within the intestines, okay? I didn't say get rid of all meat, but you want to emphasize a lot of fruits and vegetables as well, too. Ones that are not on the FODMAP list, okay? All right. All right. Good luck to you, Shane. Oh, let me show you the article, too. Okay. So here's my article on FODMAP, or on SIBO, okay? And here it is. So it stands for, FODMAP stands for fermento oligosaccharides, disaccharides, monosaccharides, and polyols. All right. And actually, I've given you a link to a FODMAP food plan here. I forgot that I had done that. I didn't even know I had that. Nope, there it is. Yeah, so this is from the Institute for Functional Medicine. All right. All right. Good luck to you, Shannon. Hello, David. Let's see your thoughts on Dr. Shoemaker's trained mold doctors and their treatment plans. Do you agree or disagree? Well, I think I kind of alluded to this earlier tonight, but generally I don't agree. So Shoemaker, he's the founder of mold toxicity. He's the guy that discovered it. The trouble is he's antiquated. He's a dinosaur. He's an antique now. He hasn't moved forward with where the field has gone. All right. And he's holding on tight to his old ideas. All right. So Shoemaker trained doctors, trained by him, and they're taught to evaluate for mold toxicity based on symptoms, but also based on the results of blood testing that relate to whether you have a genetic predisposition to have the problem. That's something called an HLA-DR test. It doesn't prove you have the problem. It just says you have the genetic profile that says you might get the problem, okay? And he has them measure a bunch of inflammatory markers. And if they're elevated, if you have the genetic profile and you have the elevation of the inflammatory markers, he says that means you've got mold toxicity. And if you get rid of the mold and you're still not doing well, then you must have something called chronic inflammatory response syndrome, okay? All right. Now, the problem with Shoemaker and the Shoemaker trained doctors is they don't recognize that there can be something called chronic Lyme infection that leads to ongoing inflammation that is the cause of chronic inflammatory conditions. Okay. They just don't recognize. Shoemaker used to be a member of ILADS and then he walked away from it years ago. He no longer believes in chronic Lyme. And so he's missing a key thing that keeps people's C4A elevated, their TGF-beta-1s elevated, their VEGFs elevated, their VIPs and everything else he measures abnormal. It could all be Lyme, and the guy doesn't recognize Lyme. So his protocols and his ideas do not work if you're a person that has Lyme. All right. So I don't agree with them. I just don't agree. They're missing a big part of the problem. All right. Also, having a genetic profile does not mean you manifest the problem. So most of us that treat Lyme disease recognize that it's better to measure and see if those mold toxins are actually in you, and that's to do the urine mycotoxin testing. All right. So that's the big difference right there. Okay. Good luck to you, David. Hello, Gemma. Let's see. What have you found best for treating Bartonella eye infection? And how do you manage major Bartonella symptom increases in your patients during treatment? Is it best to have a day off if things are very bad? Okay. So there is not a specific difference in how you would approach people with Bartonella eye issues versus ones that don't have eye issues. All right. And I assume by the eye issues, you're probably meaning visual changes, neurologic dysfunction of the eye, those kind of problems. All right. So the approach is treat Bartonella the way that I lay out in the options I give you in my How to Kill Bartonella article. So that article is called How to Kill Bartonella, a Brief Guide. In there, I lay out various herbal and prescription options to kill Bartonella. Okay, you would want to do that. If you are having big flare-ups in your symptoms, that probably means a Herxheimer reaction, in which case you want to make sure you're doing everything you can to control those cytokines that get elevated in a Herx. I talked about Herxing earlier tonight, so I'm not going to go back through that again. But in terms of what a Herx is, I talked about that earlier tonight. But Cytokines are the major cause of your Herx symptoms, okay? So you want to control cytokines, and one of the things to do is to use curcumin, 500 milligrams 3 times a day. You could even increase it to 1,000 milligrams 3 times a day. The product I like for that is made by Thorne. It's a product called Mariva 500 SF. The SF stands for sunflower. That's oil. That's what's used to microscopically wrap the curcumin to get it absorbed. Okay. The other thing to do to help with this is to be on glutathione. The Trifortipri product I talked about earlier tonight by Research Nutritionals, I think is the best. And you want to do a teaspoon once or twice a day to help with that too. If you're doing those and you're still really flared up, then you may want to cut your dosing in half. But I would talk to your treating doctor first. I'm not your doctor, okay? I'm just giving you some things to consider. All of these you really should talk over with your doctor, but especially changing existing prescriptions. Talk to your doctor. Don't do it because Dr. Ross said to do so, because I may be wrong. They know you best, okay? But you may want to consider cutting your dosing down in half, but talk to your doctor about that first, okay? All right. Good luck to you, Gemma. Hello, Rita. Can chronic Lyme and co-infections cause chronic swollen glands with lymph node enlargement in the armpits? So the answer is yes, but the one to think about especially is Bartonella. Bartonella is known for giving a lot of lymphadenopathy, lymph node swelling, basically. Okay? All right. Good luck to you, Rita. Oh, more from Rita. Let's see. My nodes and armpits are twice the normal size, and I'm being sent for biopsy. Have you ever seen this? Yes, I have. I mean, I think they should still make sure there isn't something else causing it. But if their biopsy comes back negative and all it shows is inflammation, know that they probably haven't tested them for Bartonella because they don't know about Bartonella. Okay. But a leading cause of lymph node swelling is Bartonella. Okay. Hello, Patricia. Hold on here just a minute. Hello, doctor. How long do you suggest staying on doxycycline if not getting better? My 15-year-old daughter has Lyme and Barton is on doxy for a year, but her anxiety is actually worse. Should we stop the doxy? Tried rifampin and amoxicillin, but couldn't tolerate. Thank you so much for having this session. So, in general, if the thing that you're using to treat Bartonella is working, by 2 months, you should start seeing some alleviation, some lifting of those Bartonella symptoms, okay? Things that make you think of Bartonella are pain on the balls of the feet, tremors or shakes, neurologic conditions like neuropathy and nerve pain, neuropsych issues. On the psych side, that would be things like anxiety, depression, hallucinations, air hunger can be part of it, and a scratch mark rash. Okay, now you don't have to have all those symptoms to call it Bartonella, but if you have a lot of them, that makes me think of Bartonella. So if I've got somebody that after 2 months on a regimen I came up with for their Bartonella is not showing any signs of improvement, then I want to change. I want to change to different regimens. Okay. So for possibilities on that, take a look at my article called Kills Bartonella Brief Guide, where I list numerous things you could try, okay? Let me just show that to you here real quick. All right, so look at the article. It's called Kills Bartonella Brief Guide. And if you scroll down here, you're going to see where I start talking about what I call tier 1 treatments. And I list out a number of examples of how you would combine medications, okay? You'll see it all here. And anyhow, I know it's kind of complicated, but believe me, there's many ways to skin the cat for Bartonella. And if a doxy-based way is not working, then pick any one of these other ones and see if they're going to work for you, okay? Good luck to you, Patricia. And to your daughter, too. Hello, Frank. What is your opinion on using colonics to treat Bartonella? I'm not sure colonics is going to make any difference, to be honest with you. That's my opinion. All right. Let's see. Hi, Dr. Frank. Let's see. Hi, Frank. Let's see. Dr. Ross, do you have any thoughts on the benefits of phospholipid therapy such as phosphatidylcholine as part of treatment for Bartonella? Also, if you have several positive IgG antibody tests for Bartonella, but negative IgM tests for Bartonella, could this be indicative of Bartonella infection? All right. So in terms of your antibodies, IgMs are what your immune system makes first whenever you get an infection. And most of the time, or actually what's supposed to happen, I should say it that way, is IgMs are supposed to go away and get replaced by IgG antibodies, usually 6 weeks to 3 months into infection, depending on what the infection is, okay? And then the IgMs are supposed to go away, and the IgGs will be there. Now, once you make IgGs, they are the memory of the immune system. They do not tell us whether the germ is active and still in you. It just says, yeah, your immune system has fought it sometime in the past. It may still be fighting it. We just can't say whether it's active infection or not. If you get an IgM back that's positive, it usually means active infection, especially acutely. Okay, now, recently, about a year ago, during an IGenics webinar, Dr. Burrascano presented information showing that even people with chronic Bartonella sometimes keep making IgMs. And we're not sure why that happens, but there are sometimes that IgMs don't mean acute infection. They mean that you have had Bartonella. I don't know whether it means it's active or not in those situations, okay? All right. So that answer, I think that's part of that for you. So yeah, having IgGs means you may have active Bartonella. At a minimum, it means you have had Bartonella in you, but it doesn't tell me whether it's still in you or not. For that, I would need to look at what your symptoms tell me. Okay, if you have enough symptoms and a positive IgG test, then I'd say, yeah, that means you got Bartonella, okay, and is active in you, okay? All right, and then, and I went through those symptoms of Bartonella earlier, just I think maybe 10 or 15 minutes ago, so yeah. Okay, so in terms of phosphatidylcholine is one of the phospholipids that makes up the mitochondria membrane and also makes up your nerve cell membranes, all right? The other one would be phosphatidylserine. In the nerves, I believe it's phosphatidylserine that's in greater proportion than phosphatidylcholine. And then within your mitochondria, phosphatidylcholine is in greater proportion than phosphatidylserine, or my 60-year-old brain has just flipped both. But anyhow, one of them is a little bit more in mitochondria than it is in nerve cell membranes, okay? My preferred, so in terms of helping with Bartonella, it's not going to get rid of the Bartonella infection. It may help limit the nerve cell membrane damage from Bartonella and mitochondria damage due to oxidation agents from the immune system, but that's about it, okay? My preference is to not take it as phosphatidylcholine. My preference is to use it as part of what's in ATP 360, okay? And that would be 3 pills 1 time a day. That's a product made by Research Nutritionals. It will support mitochondria. It will also support your nerve cell membranes as well, too. Okay? All right. Good luck to you, Frank. Oh, let's see here. Hello, Greg. I see. Can you provide the IGenics test numbers for the test you suggested? Let's go look at it together. I don't know them off the top of my head, but we'll do it. I'm going to do a screen share and I'll pull up the order form for you. All right. I'm just writing in the words IGeneX order form. Okay, so this is the order form. All right, so you would scroll down to page 3, all right? And the test for the, on the right-hand side column there, you see the Lyme section. The test for the Lyme immunoblot IgM is 325. For the immunoblot IgG is 335. For the Babesia IFA for beta-coni, that's test 720. For Microti, it's test 200. And the Babesia fish test is test 640. For Bartonella, the Bartonella immunoblot IgM is test 374. And for the immunoblot IgG, it's test 384. Okay. Oops. Wonder if I didn't screen share that. Anyhow, those are the numbers. I hope that showed up on the screen share. I can't quite tell from my side how that worked. All right. Very good. Good luck to you, Greg. Hello, Patricia. Hello, Dr. Ross. My daughter tested positive for one Bartonella strain on the Galaxy test and equivocal on the 3 other strains. What does the equivocal mean? So first of all, when the Galaxy test, which is a PCR test, comes back positive, if it's the enhanced PCR they did, because they also do an antibody test called an IFA test. If it is their enhanced PCR, their ePCR test, that means you definitely got Bartonella of that one strain, okay? Equivocal means that they're seeing something that might be those other strains but might not. From a practical standpoint, it doesn't matter. You've got at least one strain. All of the strains that a person gets are treated the same, all right? So how we treat Bartonella henselae is identical to how we treat Bartonella quintana, for instance, okay? So in reality, it doesn't matter. You've got proof of Bartonella here if it's the enhanced PCR test. If it's the IFA test that they do, that's an antibody test, it means you've got antibodies too, okay? Which would mean if you've got enough symptoms, it means it's probably active and in you. But that's an immune reaction test, okay? Hello, Greg. Let's see. I'm looking at the panels form from the IGeneX. All right. So I don't recommend panels. And my own, and I know IGeneX will not like my next comment, but my own take on panels is they're a way for IGeneX and other labs to make money by having you do things that are not necessary. All right. It's not necessary to get an IFA. And the PCR test that they recommend in their panels doesn't result in anything about, it only shows Bartonella or Lyme about 30% of the time. All right. So don't throw your money away. Don't do panels. Don't make IGeneX money. Do the test that I recommended earlier. That's your cost-effective way, but a good way at finding what you have. Okay. All right. Good luck to you, Greg. Let's see here. Hello, Duke again. Let's see. You mentioned in the past that you sometimes recommend Japanese knotweed. Can you tell us which specific infections you might recommend this for? Also, can you tell us what form of Japanese knotweed is best? Capsules, tinctures, stimulase extract. I have heard that Buhner recommends the capsules or powder. Thanks again for all the amazing info. So Duke, thank you. And so in general, I tend to recommend tinctures. And the reason I do is when you do an alcohol tincture, how tinctures are made, is you take 1 part of plant and you put them in 5 parts of alcohol, basically. And the active chemicals that you need then are extracted strongly into the alcohol. And then you strain off the plant parts so you don't have as much debris, basically. So I prefer the tincture because I think you get cleaner chemicals with less debris. Now, I will admit, when you hold up a tincture bottle, you can see some of the plant remnants in there, but you're not going to get them to the same degree you're going to get in a powder or capsules where you're going to have unnecessary parts included. An extract, maybe you're going to have more purity to that too. I just tend not to use them though. I think the tinctures are easier to use, and I think they're more powerful actually too. Okay, that's just my preference. All right. Okay, so knotweed, historically, knotweed has a couple of functions. Number one, it's anti-cytokine. It can actually help lower inflammation cytokines. Okay. In addition, it can treat Lyme persisters and growing forms, according to Johns Hopkins lab experiments from last year. Those experiments also showed it can treat growing and persisting forms of Bartonella. It was not tested to see if it does anything for Babesia, as far as I know. Okay, so anyway, I would use it for Bartonella. I would use it for Lyme, actually. Okay, all right, Lyme being Borrelia, that is. Good luck to you too. Hello, Kimberly. Let's see how Dr. Ross. I'm thought to be in remission from Lyme since fall of 2018. I treated with antibiotics throughout pregnancy preventively after that and had a healthy baby. Good. Glad you did. I've continued to have chronic foot, leg pain, deep muscle aches that start and worsen the more I walk or stand, which from all of the workouts I've had, I think is a neuropathic caused by Lyme. I haven't actively treated with antibiotics for 2 years, stayed on for breastfeeding. And then was on a maintenance herbal dose of Cemento and Banderol 15 drops a day until a year ago. I haven't had any Lyme symptoms other than leg pain since 2018. Is it possible this is still Lyme bacteria, or is it that unlikely since it hasn't progressed and I have no other symptoms? Thinking of another pregnancy and would like to avoid antibiotics if possible, but if I could still have active Lyme, I want to protect the baby. If I try Cemento and Banderol now and Herx, would that tell me if Lyme is still active? Also, do you have any information about phospholipid IV therapy? It was recommended to look into as an alternate antibiotics during pregnancy to protect the baby from possible transmission. So phospholipids aren't going to do anything about preventing germ transmission. They repair tissue damage, cell membrane damage, or maybe even the mitochondria membrane damage, but they don't do anything about germ warfare, basically. Okay, so I don't think that's a good go. Okay, let me give you a few comments. So, you know, the limited studies we have or limited data we have about preventing transmission during pregnancy was from a data bank that was collected of women that had active Lyme during pregnancy, and some of them were on antibiotics and some were not. The ones that were not on antibiotics, 50% of the time they had transmission, and the ones that were not on or that were on antibiotics had no transmission. Okay, but these studies were done on women with active Lyme. At least that's what I think happened with those studies. You can't find, they're not published anywhere. But it was one of the Lyme groups out in the East Coast in the late 80s, early 90s collected this information. All right. So I think there's a greater chance of transmission when you have active symptoms. Okay, that's one thought. Okay, secondly, most of us that treat chronic Lyme think that if you have not had a relapse for 2 years after treatment, that probably the germs are out of you. Now, I can't guarantee that, but that's our general feeling. Okay. And third, having just one area of pain as you do neuropathic issues does not mean you have active Lyme because you have no other symptoms. All right. So based on what you've said here, and again, I don't get the benefit of asking you a lot of questions that I would ask, but based on what you said here, I don't think you necessarily need to be on anything to prevent transmission because it sounds like it's been over 2 years. Yeah, well, 2018. Yeah. You haven't had a major relapse. I would think it's probably out of you. In addition, if you don't have significant symptoms, I think that most transmission occurs when Lyme is active. Okay. All right. Now, one other thing for you to keep in mind, you may want to take a look at, I mentioned it earlier tonight, is you have an area of injury here, probably caused by Lyme. And for that, you may want to try to do repair work. And what can repair tissue injury, muscle, tendon, ligament, and nerve injury is the peptide called BPC 157. I did mention that earlier tonight, but you might want to give a 2 to 3 month trial of it at 1 pill twice a day to see if you can make a difference for that. Okay. All right. And good luck with your pregnancy plans here. Yeah. All right. All right, everyone. That is it for me for tonight. I will be back here again with you next week on Thursday, so a week from tomorrow. In tomorrow morning's email that I'll send you, I'll include a summary of what we talked about tonight. It'll also have the link for where you can find the recording, which you all know you find it on my webinars page at treatlyme.net. And in addition, I will include a link to sign up for the next series of webinars that will begin next week. Okay. All right. So I've enjoyed being with you here tonight. I hope you got some useful information that can help you. And I look forward to seeing you again next week. Good night, everyone.